See, in most people's lives, they're going to encounter some stress-related moment or disturbance in their life that will cause them to react with an emotional or potential out-of-the-norm behavior. For instance, let's say you go into the office one Monday and your boss calls your whole team into one of the office rooms and he says, "I'm sorry, team, but I'm going to have to let you all go." How would you react to this? It would be normal in this example for you to experience feelings of depression and anxiety. But what happens when the reaction to this event becomes abnormal bereavement behavior? Well, according to the DSM-5 TR, you may be experiencing an adjustment disorder. See, an adjustment disorder is a trauma or stressor-related disorder similar to acute stress disorder or ASD, or post-traumatic stress disorder, PTSD. The major difference between an adjustment disorder and ASD or PTSD is the criteria of what is considered a qualifying traumatic event. See, whereas ASD and PTSD require exposure either by direct experience or witnessing a traumatic event like something that could have led to death or a serious injury or sexual violence, an adjustment disorder is diagnosed when the symptom pattern of PTSD occurs in response to a stressor that does not meet PTSD traumatic event criteria. So in other words, you're having a reaction to something like losing a job, or you're having relationship issues like a spouse having an affair or filing for divorce, or you lose a loved one. And the symptoms that you're showing are that of what PTSD would be symptomatic of, except the event is not in the criteria of PTSD. See, people with adjustment disorders, they fail to respond to a significant emotional or behavioral stressor in a manner that's considered to be aligned with normal bereavement patterns. So in turn, the stressor leads to impaired daily functioning due to a person just struggling to cope with the life event. Now, normally, adjustment disorders resolve themselves in 6 months or when the stressor is removed. So in the scenario earlier, when someone lost a job, let's say they begin to start a new job. Well, now the old stressor has been removed, and normally we would see the adjustment disorder dissolve. Now, within the adjustment disorders, we do see two different types of specifiers, one being acute, where an acute specifier is used to indicate persistence of symptoms for less than 6 months, whereas a persistent or chronic specifier is used to indicate the symptoms lasting longer than 6 months. Now, as someone that is focusing on marriage and family counseling, I want to take a deeper look at a specific scenario and to where a patient has an adverse reaction to a spouse having an affair or filing a divorce. So this person is having an abnormal reaction to bereavement. So in this scenario, you've been seeing Mary for about a year now, and she started coming to you when her and her husband Scott, who'd been married for about 20 years, started having some marital issues. Now, during a recent counseling session, Mary tells you that since she last spoke, Scott has filed for divorce. But that's not it. She also confides in you that she recently had sex with a man that she met at a bar. She'd not been planning to have sex, and she'd not been planning to even go to the bar that night. And in a way, she just felt lonely and felt like she wasn't even herself. And prior to this sexual encounter with this man, Scott had actually been the only man that she'd ever been with. And you recognize how upset Mary is about the decision and also how out of character this behavior is for her. Again, she tells you how lonely and hopeless she feels, and she's fearful that if Scott finds out about this encounter, that there will be no hope for any future between them. So in this time, as a clinician, you start thinking, Mary might have an adjustment disorder, and you recognize something. You recognize that the sexual encounter that she had may actually be the result of her depression. A 2024 scholarly review by Parabella et al. Found that impulsive decision-making is directly correlated with depression and anxiety, while further research by Daly et al. 2022 showed that people use sex as a coping mechanism associated with depression and loneliness. So in this moment, Mary, she's feeling overwhelmed. She's losing something that's been a part of her life for 20 years. And because of this event, she's unable to cope. She's unable to adjust. And in her loneliness, she makes a decision to sleep with a man that she normally would have not, had it not been for the circumstances and the way she felt. This could be a sign that Mary is having an adjustment disorder. So if you're out there and you're feeling like you're just not able to cope, we never want to take mental health issues with a grain of salt. There's always seriousness to them. And I encourage you that if you're feeling that you're just not able to cope over something, an event that's happened that you feel like you should be able to just get past, well, then you might be suffering from an adjustment disorder. And I advise you to go seek professional help.